chapter 65. Myself Shrija. So today you are going to learn about some of the isolated CM code classification for diseases of the circulatory system. So now let's go into the isolated CM ranges from I-26 to I-28. So I-26 to I-28 range codes describe about the pulmonary heart disease and pulmonary circulation disorders. So what are these? So these ICD-10 codes are used for diseases that affect the blood flow between the heart and the lungs. So when this blood flow between the heart and the lungs is disturbed, the lungs may not get enough blood and the heart may have to work harder. So this can lead to the pulmonary embolism and also the pulmonary hypertension. And also we can see the cor pulmonale, that is the right-handed or right-sided heart failure caused by the lung disease. So now let's talk about I-26. So what is I-26? It's a pulmonary embolism. So what do you mean by pulmonary embolism? It's a blood clot in one of the arteries of the lungs. So whenever a blood clot takes place in one of the arteries of the lungs, it leads to the pulmonary embolism. Here you can see a picture of the pulmonary embolism. How it happens actually? A blood clot usually forms in the deep veins of the leg first, and then the clot breaks off and travels through the bloodstream. So after this clot, it reaches the lungs and it blocks the pulmonary artery. So what happens when the pulmonary artery is blocked? This causes the reduced oxygen supply, chest pain and shortness of the breath. In this diagram, you can clearly see a clot traveling from the leg. So the clot lodging in the pulmonary artery. So it reduces the blood flow to the part of the lung. So at last the damaged lung tissue due to the blockage. Here you can see the blockage of the lung. So this is the pulmonary embolism. So what is the subcode? I-26.0, it is septic pulmonary embolism. Nothing but the code is used when the clot is infected. Septic is nothing but infected. So the clot carries bacteria or germs. It can cause infection in the lungs and also it can cause the abscess formation. So this is more serious than a normal pulmonary embolism because infection is also present, right? So what is the example for pulmonary embolism? If a patient has diagnosed with the infective endocarditis. So these pieces of infected material break off, they travel to the lungs, they block the pulmonary artery. So this situation, it is coded as I-26.0. The I-26.0 code has been assigned to this septic pulmonary embolism. So next coming to I-27. So I-27 is nothing but it's other pulmonary heart diseases. So these conditions mainly involve high pressure in the pulmonary arteries. This forces the right side of the heart to work harder. So when pressure in the lung arteries increases, what happens? The right ventricle must pump harder. So over time, it becomes the enlarged. This can eventually lead to the right-sided heart failure. So what is the example of I-27 subcode? I-27.0, it's a primary pulmonary hypertension, short form PPH. So what do you mean by PPH? It's a high blood pressure in the pulmonary artery, nothing but hypertension in the pulmonary artery. So no known cause, it is without a known cause. So for example, when a young adult is diagnosed with idiopathic pulmonary hypertension, you have to assign the code I-27.0. At the right side, you can see the picture of the pulmonary hypertension, and here you can see the normal blood vessel versus the pulmonary artery. So right ventricle become thickened. So stress on heart due to the, you can see stress created on the heart due to the increased resistance. So backflow because the right side cannot pump functionally. Okay. And then other diseases of the pulmonary vessels, I-28 code. So these conditions affect the pulmonary arteries or veins, but they do not fall under the embolism or hypertension categories. Okay. And I-28.0, it is arteriovenous malformation, AVM, of pulmonary vessels. So what do you mean by arteriovenous malformation? It is an abnormal connection between an artery and a vein in the lungs. So blood bypasses the normal capillary network. What happens? This causes the poor oxygen exchange within the lungs. there will be a risk of bleeding, there will be a risk of the clot skipping the lungs and reaching the brain. So when you take an example of I-28.0, a CT scan which shows a pulmonary AVM. So in that case, you have to assign the I-28.0 code. So this is the classification of the pulmonary circulation disorders. Next, coming to isolated CM code range I32, I5A. So what are these? These are the diseases of the pericardium, endocardium, valves and myocardium. What are these? These are the layers of the heart, right? These are the layers of the heart. So diseases regarding the layers of the heart are listed under the category I32, I5A. So first one, I30, it is acute pericarditis. Itis means inflammation, right? I have told you itis is a medical term for the word inflammation. So what do you mean by acute pericarditis? It is a sudden inflammation of the pericardium, which is a thin sac-like covering around the heart. So what happens in pericarditis? This pericardium becomes inflamed and swollen. So what it causes? This causes the sharp chest pain, especially whenever the patient breathes in or he lies down. So a pericardial friction drum may be heard with a stethoscope. So here you can see the pericarditis image. You can see the healthy pericardium, inflamed pericardium. You can see the difference. In healthy one, you can see the smooth layers, whereas inflamed one, you can see the swollen, irritated layers rubbing against each other, causing the chest pain. So what are the subcodes of acute pericarditis? I30.0, acute non-specific idiopathic pericarditis. So idiopathic is no known cause. Idiopathic means no known cause. So this is the most common type of the acute pericarditis. So it mostly affects the young, otherwise the healthy people. So coming to example, a young adult comes with acute chest pain and a friction rub. So there is no infection or there is no known cause. So what do you code? You have to code the I30.0 isolated code. So I31, it's other diseases of the pericardium. So these are the pericardial problems that are not acute pericarditis. So subcode I31.0, it's a chronic adhesive pericarditis. What do you mean by chronic adhesive pericarditis? The pericardium, it becomes thickened and scarred. So it sticks or adheres to the heart. So it usually occurs after an infection, surgery or long-term inflammation. So what does this causes? It causes restricted heart movement, reduced ability of the heart to expand properly. It can also lead to the chronic chest discomfort and reduced heart function. So what is the example of this chronic adhesive pericarditis? Maybe when a patient had an infection a month ago, now the pericardium is stuck to the heart. So this is called as a chronic. Chronic is nothing but a long time, right? A long-term effect. So this is the chronic adhesive pericarditis. You have to assign the code I31.0. And I32, pericarditis in diseases classified elsewhere. This code is used whenever the pericarditis is not the primary disease but occurs as a complication or a secondary condition due to another underlying illness. So what is the key point over here? You cannot use I32 alone. It must be coded with the main disease that causes the pericarditis. So example is LE. Nothing but a systematic lupus erythematosus pericarditis. So whenever this SLE is diagnosed, you have to assign the code I32.X. So kidney failure, infections, rheumatic diseases or cancer may also cause the secondary pericarditis. And next I33. I33 is acute and subacute infective endocarditis. So what do you mean by endocarditis? Infection of the inner layer of the heart, especially the heart walls. So this is caused mainly by the bacteria traveling through the blood and attaching to the walls. So what happens? A bacteria from vegetations on walls and then walls become damaged and leaky. So patient may develop fever, murmurs, emboli and severe complications. So at the right side you can see the picture. The picture shows a bacteria infecting a heart wall. So vegetations form on the wall surface. You can see vegetations are nothing but It's a infected clumps. You can see the clumps on the heart walls, right, in this picture. So these weakens the wall. So these infected clumps, these weakens the wall and they disrupts the blood flow, resulting in endocarditis. So subcodes under endocarditis is I33.0. It is acute or subacute infective endocarditis. So it is used whenever a known organism is causing the valve infection. What is the common bacteria over here? It's a Staphylococcus aureus and Streptococcus species. So what is the example? Patient with Staph aureus bacteremia develops a wall infection. So in this case, you have to assign the code I33.0. And then coming to I33.9, endocarditis unspecified. So this is used when the doctor says endocarditis, but there are no details are given. So no organism is specified, no indication if acute or chronic. So you have to assign the code I33.9 in these cases. So next I34, it's a non-rheumatic mitral valve disorder. So what do you mean by non-rheumatic mitral valve disorders? So this includes the mitral valve diseases but not caused by the rheumatic fever. So this mitral valve function, this mitral valve, it is located between the left atrium and the left ventricle. It ensures blood flows in one direction. The role of valve is nothing but it ensures the blood flow in one direction. If damaged, the blood flows backward, resulting in regurgitation. Regurgitation is nothing but the blood flowing backwards. So here you can see in the picture a normal heart and also the mitral valve prolapse with the regurgitation. So in normal valve you can see with proper valve closing here, the mitral valve, whereas in this mitral valve prolapse you can see the blood is leaking back into the atrium. So this is atrium, right? Here you can see clearly the blood is returning back into the atrium. So this is the mitral valve prolapse with the regurgitation. So subcode I34.0. So mitral valve insufficiency. So whenever a patient is diagnosed with the mitral valve insufficiency, you have to assign the code I34.0. So what are the causes of the mitral valve insufficiency or regurgitation? There may be a degenerative changes, nothing but weakening with the age. It may be a mitral valve prolapse. It may be a post-infection changes and also the ruptured chordae tendineae. So for example, if a patient with degenerative mitral regurgitation comes to the provider, so what you have to assign the code? You have to assign the code I34.0. It is clearly. Okay. And next coming to I35. I35 is non-rheumatic heart valve disorders or non-rheumatic aortic valve disorders. So when these codes are used when the heart valves are diseased but not due to a rheumatic fever. So they cover aortic, tricuspid and pulmonary valve problems. So coming to I35, it's a non-rheumatic aortic valve disorder. I35.0, it is the aortic stenosis. So what is the aortic valve function over here? This aortic valve, it is situated between the left ventricle to aorta. It pumps the oxygen-rich blood to the whole body. It must open fully and it must close tightly. So aortic stenosis results in the narrowing of the aortic valve. So this makes it difficult for the heart to push the blood out of the left ventricle. So what is the common cause for I35? Calcific aortic stenosis. Nothing but a calcium deposits, they stiffens the walls, they stiffens the aortic wall. Whenever for example, an older adult with calcific aortic stenosis is diagnosed, then you have to assign the code I35.0. In the picture, you can clearly see a normal valve opens into a widely, whereas stenotic valve, it opens only slightly. So restricted blood flow. The valve looks thickened and also it looks like stiff. So next coming to I36 code, non-rheumatic tricuspid valve disorders. So the I35 is about aortic valve and I36 is about tricuspid valve. So what is the function of the tricuspid valve and where it is located? It is located between the right atrium and right ventricle. So it ensures blood flows in one direction towards the lungs. So what is the subcode for non-rheumatic tricuspid valve disorder? I36.0, it's tricuspid insufficiency. So what is the meaning of tricuspid insufficiency? Here valves does not close properly and the blood leaks backward into the right atrium. So for example, when functional tricuspid insufficiency due to pulmonary hypertension, what you will code? You have to code I36.0. And then next, non-rheumatic pulmonary valve disorder, that is I37 code. So pulmonary valve, this is located in between the right ventricle and also the pulmonary artery. So it controls the blood flow to the lungs. So what is the subcode of this one? I37.0. Pulmonary valve stenosis is nothing but narrowing of the pulmonary valve. So valve does not open fully and blood flows to the lungs becomes very difficult. So here you can see the picture in the pulmonary valve stenosis, healthy heart versus the pulmonary valve, and in the healthy one, the valve opens widely, whereas in stenotic valve, it opens only a small amount. You can clearly see the valve fails to open fully, making blood to flow difficult to the lungs. So right ventricle must work harder in this case. And this is about the non-rheumatic aortic valve disorders, tricuspid valve disorders, and also the pulmonary valve disorders. So I38 is nothing but endocarditis unspecified. So when you have to use this code, when the provided documents endocarditis but does not give a specific cause, whether it may be a bacterial, viral, or etc. So you have to think of I38 as a default or catch-all code. For example, the chart just says patient has endocarditis with no further detail. Then what you have to do? You have to assign the code I38. And coming to next, I39, endocarditis in diseases classified. So you have to use this when another disease is the underlying cause of the endocarditis. So this endocarditis is a secondary to the another systemic disease. So what is important here? You will need to assign two codes. One for the underlying disease first and then I39 code. For example, endocarditis caused by syphilis. So syphilis code is A52.X plus I39.X. So you have to need two codes to assign for this endocarditis in disease classified elsewhere. So next, I40 code for acute myocarditis. So what is the meaning of acute myocarditis? It's an inflammation of the heart muscle, right? It's an inflammation of the heart muscle. Heart muscle is nothing but the myocardium. So this code is used whenever a myocarditis is acute and it is clearly documented. And subcode I40.0, it is an infective myocarditis. This is used when myocarditis is caused by an infection. So the most common type is the viral infection. For example, myocarditis after influenza. So it is a post-flu myocarditis. You have to assign the code I40.0. At the right side, you can see the picture of the myocarditis, the normal myocardium and inflamed myocardium. So in normal myocardium, you can see a clear smooth muscle layers. So there is no swelling over here. You can also see the normal coronary blood vessels and also the pericardial layers intact. Whereas coming to the inflamed myocardium, you can see the thickened and swollen muscle tissue, the inflammatory cells within the myocardium. So it can affect the conduction and it can weak the heart. So this visual, it helps to you to understand what inflammation physically does to your heart muscle. So in this slide, you have learned about the endocarditis and myocarditis. Endocarditis is nothing but it's an inflammation of the inner lining of the heart, whereas myocarditis, it's the inflammation of the heart muscle. So next, coming to I41, 42, 43, 44 codes. So what is I41? Myocarditis in diseases classified elsewhere. So when you have to use this code, whenever this myocarditis is caused by the another systemic disease. So you have to code two codes here. You have to assign two codes. One for the underlying disease first and then for the second code is for myocarditis. So for example, when a patient is diagnosed with myocarditis due to lupus, so you have to assign the lupus code first and then followed by the I41 codes. So myocarditis always it comes from the another disease. So then I42 cardiomyopathy. Cardio means heart, myo means muscle, pathy means disease. So what it is? Heart muscle disease. It's a disease of the heart muscle. So what it causes? So that it becomes the heart muscle becomes enlarged, thickened, stiff and also weak. So what is the subcode? I42.0. It is dilated cardiomyopathy. So what happens during dilated cardiomyopathy? The heart chambers, they become large and stretched. So the pumping ability, it decreases. For example, alcohol-induced dilated cardiomyopathy. You have to assign the code I42.0. And then I43. It's a cardiomyopathy in diseases classified elsewhere. So this is used whenever the cardiomyopathy is secondary to the another condition. For example, thyroid disease, it leads to the cardiomyopathy, which is thyroid disease code plus cardiomyopathy in disease classified elsewhere. So this is the sequence of how you code this cardiomyopathy in these conditions. So next I44. I44 is AV block and left bundle branch block. So AV block means it's a delay in the electrical conduction between the atria and ventricles. So what is I44.0? It's a first degree AV block. So the PR interval is greater than 200 milliseconds. So it's a midless type of the heart block. So it is usually the asymptomatic. So in the right side, you can clearly see a picture of the types of cardiomyopathy and a normal heart. So first one is a normal heart, normal muscle thickness and regular chamber size. Whereas coming to second one, the hypertrophic cardiomyopathy. In this, you can see the thickened muscle walls. You can see the heart chambers become smaller over here. You can also see this can block the blood flow. Whereas in dilated cardiomyopathy, you can see the muscle walls are stretched, enlarged heart chambers. So muscle walls become thin. Its pumping ability is weak. Whereas restrictive cardiomyopathy, it's a stiff, rigid heart muscle. So heart cannot relax properly. A filling is restricted in this restrictive cardiomyopathy. So this is the differences between the types of cardiomyopathy and the normal heart. So next coming to the codes I45. What is I45? It's for other conduction disorders. So these codes, they describe the problems in the electrical wiring of the heart. For example, I45.1 for right bundle branch block and I45.2 for bifascicular block. The right-sided electrical conduction is delayed in the I45.1 and in I45.2, so two conduction pathways are blocked. So this is more serious than the isolated right bundle branch block. So next I46 for cardiac arrest. So what do you mean by cardiac arrest? Heart stops pumping. So whenever the heart stops pumping, you can find the cardiac arrest, nothing but electrical failure. So there is no pulse rate in this. You will not able to see the effective circulation, and also it requires CPR and defibrillation. So whenever a patient is diagnosed with I46 or cardiac arrest, you have to assign these code. So next coming to I47 for paroxysmal tachycardia. So what do you mean by paroxysmal tachycardia? Paroxysmal means it starts suddenly or it stops suddenly. Okay, whereas tachycardia means faster heart rate. So what are the subcodes of the paroxysmal tachycardia? I47.0 for re-entry SVT. In this you can see a looping electrical circuit. It causes the rapid heartbeat. So it is most common in the young adults. It is often treated with the megalvanivars or also the adenosine chemical. So here you can see the picture of PSVT. The diagram shows the SA node sending rapid signals and signals looping abnormally and a pathway creating a fast circular rhythm. So this produces the paroxysmal supraventricular tachycardia. Okay. And then I-49. So what is I-49? Other cardiac arrhythmias. So what do you mean by cardiac arrhythmias? So these codes cover the rhythm problems that are not included in the earlier arrhythmia categories. For example, I-49.0. What it is? It is a ventricular fibrillation. It is a life-threatening arrhythmia. The ventricles quiver instead of the pumping. So this leads to cardiac arrest if not treated immediately. So this requires the defibrillation, nothing but shock. It requires the shock treatment. And then I-50 code. So what is I-50? It's a heart failure. So whenever heart failure is diagnosed, you have to assign the code I-50. So heart failure is nothing but the heart cannot pump enough blood to meet the body's needs. Right? You can see this clearly on the slide, on the picture. Normal heart, it's a normal size, normal pumping. Whereas in heart failure, you can see the ventricles are enlarged and you can see the weak contraction. So I-50.1 for left ventricular failure, I-50.2 for systolic heart failure. So in left ventricular failure, what happens? You can see the ventricles fail to flow the blood. You have to assign the code I-50.1 for left ventricular failure. And then coming for systolic heart failure, the heart muscle is weak over here and it cannot squeeze the properly. So it can be acute, it can be a chronic, and it can also be a acute on chronic. So what do you mean by HFrEF? It's a heart failure with reduced ejection fraction. So these modifiers must be coded whenever it is documented. And I-51 for complications and ill-defined heart diseases. So what are these? These codes are used for the miscellaneous or rare serious heart complications that don't fit other categories. For example, I-51.1 for myocardial rupture. So what do you mean by myocardial rupture? A severe and often fatal complication where the part of the heart muscle tears, usually after a large heart attack, a trauma, and a severe myocardial weakening. So this is a critical emergency, right? So this is all about today's session. I hope this session has helped you to learn about some of the isolated CM classification diseases. So in the next session, you are going to learn the continuation of I-51, maybe from I-52 to I-99 series in the next session. Thank you.